Hello, and thank you for joining the web series Getting to Know You, presented by the International Medical Informatics Association Student and Emerging Professional Special Interest Group. My name is Lori Block, and I'm here with Dr. Rothgaard. Thank you so much for joining us today.
Thank you for having me.
Can you please introduce yourself and tell us about your research?
Yeah, so I'm a nurse from way back in 1989, and my clinical background is from pediatric department in one of the biggest hospitals in Oslo, in Norway. So I started out my career within a master's degree in didactics. And later I took a PhD in nursing science with a program already running from Professor Ruland in the Center of Shared Decision Making and Nursing Research in Oslo. Now the center is called the National Center for E-Health Research. The research program that I was a part of was called Connect, and with the overall objective to contribute to knowledge and innovation needed to advance ICT areas for timely and secure and seamless collaboration between the chronically ill patients and appropriate level of care. That was already in 2006 we started up. This project mainly focused on a problem-oriented perspective with the focus on patient preferences, signs, and symptoms. So when I came in with a background from nursing documentation, I figured out, well, we need also focus on patients' strength and resources. So that was kind of my intentions with my research. So this obviously became a focus on content mainly because the content part was lacking. So I started out with a concept called health assets, which originally was used the first time within nursing. And by Dr. Rosella Schlottfeldt at the Case Western Reserve University in Ohio. And I realized that when I was taking my first PhD courses in the very same university. And I didn't understand what health assets meant, but obviously this was something that had been a focus in many traditions later, not only in nursing, but in medicine, in psychology, in sociology, and so on. So I started out with a concept analysis, and that's where it started. In this technology program, I was asked, what has this to do with technology? And well, technology is not only about the technology, it's about what technology is supposed to support for practice. And this was the very, very beginning of this research.
Wow.
So, and part of this, while working back and forth, my focus on documentation, of course, was part of it as well. And we did some kind of mapping work between ICMP and the content that this concept of health assets covered, as well as did some patient preferences work and mapping with UMLS. So yeah, that's some part of my background.
So with your amazing research and clinical background, how did you get involved with IMIA and the current working group you were affiliated with?
Yeah, I was invited by Anne Moen, who was the Norwegian representative of IMIA and I at that time as an observer, and joined this because, well, informatics was of the big interest. And what I fancied with this, I also took a course at the Colorado University on nursing informatics and terminologies with Diane Skiba as a tutor. So that was so interesting when I first came into IMIA and I met all those grand old ladies, not all at that time, but all those prominent researchers within nursing informatics at that time. And so it's been a while now, since like 2007, 8 or something. And then later took over the national representative from Anne Moen. And yeah, well, and today I'm the chair of the group from January this year.
Excellent. So noting your involvement, can you tell us more about the activities of that working group? What kind of things you're doing, what kind of work the group is doing?
Yeah, so The main work of our group, well, it started up actually in 1982. So next year we have a 40 years anniversary in this group, and
Congratulations.
a long while ago. So nurses usually are pioneers, and I think that nurses have been pioneers within informatics as well within health, well, we can be proud of that. EMEA NI is actually the world body for nursing and health informatics. We like to look at it that way. And the focus is to foster collaboration, networking amongst nurses and others who are interested in nursing informatics, and facilitate the development and being kind of in the lead of the progress. And we aim at sharing knowledges, experiences, ideas, for healthcare workers and nurses worldwide, and to practice nursing informatics and see the benefits and of this in both management and education, and as well as clinical practice. What we're doing mainly is, well, we arrange conferences every third and fourth year. It has varied. That is the main big happening that we work towards. And also we work with strategic plans on how to drive this development and collaborations. So that are the main keywords, collaboration and networking. I also would say that some examples from the work that EMEA NI have been driving has been published by both Evelyn Hovenga as well as Marianne Thalberg, previous chairs of EMEA NI. They have been writing about this, and it's an article from way back to 2009, where Evelyn Hovenga looks at the big nursing informaticians and the work that they've been doing. And I can tell you that ISO reference terminology model for nursing is one of the outcomes of this work, as well as the International Nursing Minimum Data Set. And we're still talking about it. We're still using that, and it still is there to support the development in various countries around the globe. And I think that is two amazing, good examples that this group have been working. And how can we contribute like that? There's a lot of white papers, there's a lot of contributions from the members in books, etc. And we have various working groups within EMEA NI where anybody can, who is interested and have the research area, can join. So we have the NI Health Informatics Standards Group. We have the Nursing Education Group for NI. We have the NI Evidence-Based Practice Group and Consumer or Client Health Informatics Group. At the moment, we are looking at how can we follow up. It might be that we need more working groups or other working groups in addition to this. So we are at the moment working with the survey amongst the members to see whether we can get a boost on more of these groups. It goes like in waves, and at the moment some are in the bottom of the wave and some are on the top of the wave. So we want to ensure that these working groups will be living. Yeah. I can also say that now it's Nick Hardiker who is the chair of the working groups, and as he say, this is the engines of our member activities, and I think that's a good expression.
That's a great expression.
Yeah, isn't it? So if you have a specific interest within nursing informatics, you want to share, you want to discuss, you want to work together with others, find others who's interested in the same field of interest as you. This is a perfect arena for taking the steps further, and yeah, being pioneers and working out your ambitions together with others.
So if someone wanted to get involved with the EMEA Nursing Informatics group, one of those working groups might be a great place to start. Is that correct?
That's a great place to start. And of course, there's only one. We are organized, so there are our members are. it's one representative from each member society. It might be a country, it might be a data organization or whatever. You can also be a member through institutional members. Everybody's welcome as long as they're interested in nursing informatics.
Oh, thank you so much. And then finally, we have one more question. And in your mind, what do you think one of the biggest challenges in health informatics is right now? And perhaps some reflection on how we might overcome it.
Yeah, well, that's the
it's a big question.
Big question, and I don't think I have the answer to it. But for me, it's how to maneuver and keep track on the development and the possibilities that informatics actually bring on the arena, and the perspective of nursing informatics. For me, it's, if you go back to my original interest for informatics, it's all about how can technology support best practice, and not only do research, but how can we actually make research work in clinical practice, and not only reinvent the wheel, but join the forces, because I believe that if nurses join forces, we can be very powerful, and we can bring powerful services out there in clinical practice. And I think that is the most important for me. And not only to focus on technique just because of technique or technology because of technology, but how can this really help us out? And we need more educated nurses within nursing to really see the challenges, because I think that we've seen examples from, for example, development of electronic patient record systems, that there are some good solutions, but there are also some less good solutions. And we should not build solutions that build up around a malpractice. We should build it up what could be the possibly best practice, and how can technology support us in this. And I think this is really, for me, a very important difference. It might be a good, lots of good ideas, but you also need to anchor those ideas into more structured thinking and theories and best practice thinking. Of course, there's a lot of possibilities, and I'm curious about everything about AI, VR, yeah, you know, all those things, and how can we use big data? How can we build up good systems for that? I think that this is the future, but we need to be aware of the steps into this fields.
And nursing has a spot in that all the way through.
Yeah, exactly.
Well, I can't thank you enough. Thank you so much for joining us and spending time reflecting on these questions. We'll put your information in the video, and again, just thank you so much on behalf of the Student and Emerging Professional Group with EMEA.